Hi, my name is Kristen. I will be doing my week 3 skills video where we do perineal care, bed bath, and linen changes. So first things first, enter the room, make sure you knock the door, and then provide privacy because you are doing a bed bath. So you want to make sure that the curtains are pulled all the way around or the door is closed, whatever's available to you. You'll introduce yourself to the patient, verify that you have the correct patient. So you come in, tap, and make sure they're awake and everything's all good. And then you want to do hand hygiene before you get started with any actual bed bath. So foam in, foam out in all cases. So from there, you'll just explain to them the process. So we're going to get your bed changed for you today. We are going to get your bath done, get you all cleaned up. Is there anything that you need right now before we get started?
Nope, I'm pretty comfortable.
Okay, so we will start with our water here. Make sure we have the correct temperature, make sure it's not too hot, not too cold. So you always want to make sure patient comfort. A lot of patients like cooler baths. That's their choice at that point. But you want to double check not only with your own hand to make sure you're not going to burn them, but also I always like to check with the patient. I just take it and place it right on the inside of the wrist here just to make sure that they're okay with the temperature as well.
Yes,
before
that feels
we get started.
Perfect. Thank you.
Starting there, I always fold the top sheet back just to about the waist or so. We've still got the gown on, patient's still fully covered. We're going to start off with the face.
Okay.
So before you add your soap to your water, you're just going to take a clean washcloth, dip it in your water and get it good and damp. And you're starting with the face and especially the eyes. You want to work from the inside corner of the eye out, gently rubbing away any debris. A lot of people have just eye gunk that builds up there, especially if you're in a hospital setting for a long term. So you want to get that good and clean just for their comfort and just to prevent infections. From there, you'll start around the face, working your way down. So start at the forehead, going around the cheeks, down the side of the face, around the lips. If you have lip balm, this is a good time to place lip balm on the patient, keep their lips from getting chapped. So at this point, you're getting a new washcloth. So this one's soiled from the face. You throw it to the side, get a new one, and you're going to add soap in because we're moving away from the face at this point. So you will take your gown off, your patient, trying to keep them as well covered as possible. So.
And to raise the bed, you've got your little icon on the outside rail there.
Oh, does this one have the outside?
It does.
Okay, I was about to go to the foot.
Nope, yeah. It's very fancy.
We have stretchers in the ER. We have foot pedals.
I've got one of those down there too. It's not the nice drive itself cart.
All right, moving the bed up to working height so you're not bending over the patient the entire time. And I always pull the rails closest to me down so that it's out of my way as I am working. Now, I'm not going to step away from the bed at this point, so I want to have everything within reach. That way the patient doesn't have a risk of rolling off the side towards me where the rail is down. So I'll reach over, grab my new wet washcloth that does have soap on it at this point, and I'll start at the shoulders and start working my way down, keeping the patient as covered as possible for their own comfort. And just, a lot of people get embarrassed if they are fully nude in a room, even if it is a hospital setting. It's a very vulnerable position for a lot of people. So you'll work all the way down outside the arms, making sure to get the hands really well. One thing that I've noticed is that in long-term care facilities, people get really long nails. So I have long nails myself. You always want to clean out from under these nails. It's a hotbed for infection. They can scratch themselves, create more problems there than what you need. From there, you're going to lay that to the side. Take your bath towel and just gently pat dry the area that you've just cleaned. New washcloth, once again, warm and wet and full of soap, and you're going to work across the neck and the chest. Now this one does have an ostomy, so we are not going to work with that a whole lot. That you're going to have a nurse in here when you're doing ostomy care. So you'll work all the way across, keeping the patient as covered as possible, but you don't want to put the soiled linens back on the clean body. So at some point you are going to have to expose the patient as you work down, but you're going to work as fast as you can at this point, working all the way across. So you're going to roll your linens away. just to keep them away from you as possible. And every time your washcloth gets soiled visibly, you have fecal matter on it, you have bodily fluids on it, go ahead and change it and get a new one. It doesn't matter if you're still working on the same spot. You always want a clean, fresh washcloth when you're working. So you'll probably change out several times, always have a large stack ready for you. And you'll keep working all the way down the legs, as much as you can get while the person is laying on their back, all the way to the feet. And again, this is another place that if someone comes in from like a home, they've had a fall, a lot of times you'll have fecal matter from the waist down. And again, check all cracks and crevices, get between the toes real good. It's not a fun experience to clean all that up, but it's necessary. You don't want to leave this on the patient. So from here, you will move on to perineal care once you've got this entire side done and you've patted it dry with your bath towel. So you want to keep them good and clean and dry. Try not to leave any excess moisture on the body. All right, so from here we are starting with new towels. You're starting with your perineal care. Now this is different if you have a Foley in. You might have different things necessary at that time. So you'll be cleaning the end of the Foley that's outside the labia at that point. But you will start with the side away from you, spreading the labia and cleaning down and away. You always want to clean from front to back on a female. Never bring it towards the front of the body. So down and away from you. New washcloth every time you make a motion here. This is one of the most important parts of constantly revolving clean washcloths. From there, you'll go down and away on the side towards you. You'll make sure you get another clean washcloth. Clean the inside of the thighs, away and towards. Now, if they have a Foley, you will clean the Foley first, then the labia. And you always grasp it right at the entrance point to the body and clean away from the body at that point, making sure not to tug on the Foley itself. But once you're all clean, you've got everything you can reach from the front side. At this point, you're going to turn your patient. So we're going to go ahead and take the gown all the way off. Go ahead and get it and the top sheet up and out of the way. So your patient's clean, you're dry, and you're going to turn them on their side so that you can clean their back, clean the anal area, and move from there. So you're going to lift at the leg, have them place their foot flat on the bed. If they're able to help you turn, this is wonderful. This is a good time to save your back. Let them turn themselves. But move their arm across. Oops. And of course with dummies, it doesn't like to stay where it belongs. But you're going to grasp at shoulder and at hip and help them turn. So you want to make sure that their bottom arm is not tucked under them in an uncomfortable way. And you want their top arm to grasp your side rail. So have them grasp. From here, you're getting clean washcloths. Sometimes it's easier to move your whole tray table with you, especially if it rolls. But clean washcloths, and you're starting at the back, going along the back of the arm, your neck, your back, and again, every time you change a section, clean washcloth. You want to make sure that the patient stays clean as possible during this entire procedure. See if my patient will stay upright. And again, once you start the perineal area from the rear, you're going to work from the front of the body backwards. Again, you do not want to be scraping any fecal area towards the front of the body. So you'll start right here under the thigh and scrape back and up as you need to. Of course, if your washcloth is soiled, get a new one. This could take a lot of washcloths depending on how soiled your patient is. But you'll clean them thoroughly all the way around. And then of course pat them dry. You don't want to keep any excess moisture, especially in cracks and crevices. One thing that I've noticed with bariatric patients is any excess moisture in these cracks and crevices can lead to the buildup of yeast. We don't want that. So another clean washcloth, you're washing down the backs of the legs and all the way to the bottom of the feet. Okay? And if, like I said, anytime it's soiled, get a new washcloth. I know I'm repeating myself, but sometimes it's necessary. All right, at this point, it's time for you to change your bed linens. So once your patient is clean, they're dry, you don't want to leave them on soiled, dirty linens. So you'll start with your corners, top and bottom, and tuck and roll towards the patient. You want to roll as much of the linen up into a small little tube as you can, right up against the patient's back. And I always try to lift the top foot and place it right directly on the roll, but you do not want it touching bare bed. Okay? So you will get your clean linens, your clean gown, all of it, and change it thoroughly. Oopsie, I'm dropping my soap. So I'm starting with my fitted sheet here, and I will tuck it at the top and bottom corners. There we are. Now go ahead and get it on the mattress on the side closest to me. I'm just going to reposition the patient's pillow so it's still supporting his head, but it's more towards the dirty side at this point because it still does have a soiled pillowcase on it. Oops, goodness.
These sheets barely fit these beds.
Yes, they do. And I'm not doing a draw sheet for this patient.
No.
So
if you want a chuck, there's one right
I do want a chucks. My patient is possibly soiled, so.
It kind of hurts my soul not to have one on because you just never know.
It does. All right, so I've got my chucks. I'm going to roll it up inside of my top sheet so that the edge is barely on our edge of the bed over here.
And just be sure the blue side is not the absorbent side.
Oh, is this one not for y'all's? Because ours is blue.
It's an old one, so the cotton side is actually the absorbing side.
See, we're backwards.
It's okay.
Fix that.
Worked at Monument, so I kind of figured that's what.
It's supposed to say blue side up. What is blue side up?
Well, these are from, when Florence Nightingale was around, and at that point, it was not blue side up.
No. All right, so roll it to where it's just barely on the edge of the bed over here. You've got your two rolls together. You're going to take your clean roll and slide it shortly underneath your dirty roll here. That way that when you pull them out, they pull out together. And again, sheets that barely fit.
Yeah, if it keeps coming off, we'll just tuck the top and forget about the bottom.
All right, from here, you're going to have your patient roll back over. You want to ensure that they know that they are rolling over a large bump here in the middle of the bed. Otherwise, they might get stuck on it. So you want to help them shift all the way over and onto that side. So you'll make sure this knee is still bent. Helps them pivot. You'll have one hand on the hip, one hand on the shoulder, so you have good bony prominences there to grab hold to. And you'll help them shift backwards onto their back, flat on their back, all the way over that bump. Straighten out that leg, and we're going to shift and do it from the other side, so they're all the way over on the far side. So if you have a helper, it's always easier when you have two people during this part, but you will move and shift the entire patient. Make sure they are entirely on the clean linen now that they are a clean patient. You'll discard all of the old linen into a linen hamper, up to and including your pillowcase. Never want to forget that. A lot of people sweat a lot, especially at night. So you will tuck all your linens flat across. You'll have your chucks directly under your patient's hips, which I'm actually a little low here. But as we shift, we can do that. And your patient can roll back flat at this point. You want to get your patient in a clean gown. Make sure they're good and comfortable. So you'll assist them with that. And now your patient no longer has to worry about being exposed. Make sure they're comfortable there. Some gowns have snaps, some of them tie in the back. This one is a tie, so it will go right there behind the neck. Next thing is to get your clean sheet over the patient. Make sure they are nice and toasty warm. And I have a draw sheet here.
Oh, shoot. Sure.
Okay, this one.
There.
I grabbed the wrong one. All right. Now on sheets, you always want to make sure that the stitching side is away from the patient because especially people with sensitive skin, that can cause abrasions. A lot of elderly have super soft, paper thin skin, and anything that can will tear their skin. So you want to give them the least amount as possible of opportunity to do so. So you will cover up your patient all the way across, and you want to tuck your bottom corners. So as you're doing this, you will tuck the excess down the mattress and underneath, lifting the corners as needed. And each time you do a hospital corner, you want to tuck to the side and just create an angle there to where you have a good sharp angle at the top of the corner and all the way down the bed, and tuck the excess. This keeps all of it out of the way and make sure that you're not going to get it caught in the bed rails. It's not going to be a tripping hazard as you walk past the bed. Okay? And last but not least, we have to put our pillowcase back on, our new one. You want to make sure you wipe down the pillow with Sandy wipes or whatever's necessary between changing it. But you'll take two corners. Easiest way is to tuck them together. Push it all the way to the bottom of the pillowcase. This way you don't have to tuck the pillow under your chin because you don't want to get that close to your face. So you're in there. The pillow will flatten out. The corners will go to the corners of the pillowcase itself. And you'll gently place that underneath your patient's head. All right. And that includes the bed bath and the changing of the linens. You always want to, last step before you leave the room, make sure the patient doesn't need anything right then. Make sure they don't have any need to go to the bathroom, snacks, drinks, water, whatever. And also check to make sure that their call light is within their reach. Let them know how to use it. You'll take all your dirty linens with you, any trash, as you exit the room so it doesn't stay in the room with the patient.
Perfect. And how about the bed height?
Oh, and we do need to lower the bed. I am mistaking myself there. So all the way back down so that, goodness forbid, anybody does actually make a fall, it's not very far. Take your dirty linens and leave as you go. And you'll have glove changes between perineal care and your dirty linens coming out, new linens going on. And I realize that I completely forgot to do glove changes throughout this entire video.